Healthcare-onomics, changing healthcare by changing the way you think about healthcare. Hi, everybody. Welcome to Healthcare-onomics. I'm Dr. Kevin Wade Casey, your host. And this series that I'm starting out on is one in which I hope to expose ObamaCare with my special guest, Rich Weinstein. Rich is a certified financial planner and a registered investment advisor in the greater Philadelphia area. I love their cheesesteaks up there. I've been to both Gino's and the other one. I forget the other one, but I couldn't decide. I like Texas cheesesteaks better, to be honest with you, not to be a snob, but... in any case, Rich has been doing a lot of research, and he is actually the gentleman. He's probably the most famous guy you've never heard of at this point in your life, because he is the man who brought us famous videos of Obama architect Jonathan Gruber, the health economist who helped shape and fashion Obamacare for the Obama administration. Rich uncovered some videos of Mr. Dr. Professor Gruber saying things like, this.
Much the same thing, but why does it matter? You'll see. And they were posted in that past. Because the American voter is too stupid to understand the difference.
Or this.
Lack of transparency is a huge political advantage. And basically, call it the stupidity of the American voter or whatever.
Yeah, you heard that right. Jonathan Gruber thinks that Americans are stupid. And in fact, he thinks that we're so stupid that we fell for Obamacare and allowed it to get passed. So, Rich, tell us a little bit about yourself and how are you doing today?
I'm doing great. It's glad to be on your podcast. This is my first podcast.
Great.
So I hope I don't mess it up too much. Whenever I see a podcast, the first thing I do is I look in the background behind somebody and I kind of see what their secrets are. So I made sure that I cleaned up my background. And if you look on one side, you'll see what looks like an American flag. It's actually, I live near Valley Forge, and that's actually George Washington's battle flag. And if you look on the other side, there's a white wall, and on that wall is a whole bunch of pictures. And those are all the people that sent me pictures and autographed them and signed them from my experience with the Affordable Care Act. So I got Mitch McConnell back there, Katie Pavlich, Glenn Beck. I put up a whole wall. Someday I'll have to take it down, but I'm not quite ready to take it down yet. It got crazy for a while. It got really crazy.
I'm sure those represent some of your battle scars. Wow. So I love the American flag. George Washington is one of my heroes. Of course, a flawed man in some respects. I know the truth behind George Washington, but I've been to his home there at Mount Vernon. It's a wonderful setting, a wonderful place. I'd love to be buried at the foot of a hill right next to my estate. That would be great, but I don't think it's going to happen. But in any case, pardon me. So, Rich, tell us a little bit about yourself and what you do for a living.
So, like you said, I'm a registered investment advisor, and I'm a certified financial planner, and I actually have an insurance license, which puts me above most of the people that are telling me what I should do with my own life. I've been practicing with individuals as a financial planner since like the mid 90s. Okay. And I started my own companies around 2000. So I started my own registered investment advisory firm in 1999, 2000. And then I had to start because of the licensing and everything, I had to start a separate firm for financial planning and insurance stuff later after that. My experience in healthcare or health insurance.
Excuse you.
Yeah, excuse me very much. Hey, feel free to correct me because I'm going to say the wrong thing many, many times.
That's all right. It's my pastime.
Yep. My experience leading up to the Affordable Care Act being passed in the health insurance or healthcare, area is just about zero. As a matter of fact, I didn't even take care of my own family's health insurance. My wife did. Yeah. So, because I wanted nothing to do with it.
Why is that? Can I interrupt you and say, why is that? Because it was so complicated, probably.
Well, actually, from my family's perspective, I just thought it was simple. We picked what we could afford. We wanted a high deductible plan. That's what we wanted. We wanted a high deductible plan. We're young, and we felt we could manage our finances properly through that type of plan, and it made sense for us. Now, I was told it was a junk plan, and I was told that it was the wrong thing for me. But I was told it was the wrong thing for me by people that don't even understand what the word insurance means. And it's funny when you take the insurance exam and you get the study guide turn to page 1 in the study guide, and it says insurance, and it defines insurance.
Yeah,
and
yeah.
it defines it as risk management.
That's right.
So I've had people say, no, you just wanted to gamble. I said, no. Insurance means the opposite of gamble. Insurance means risk management.
That's right. That's
and
right.
nobody can decide how to manage my risk better than I can.
That is a fact.
So I mean, just as an example, when I work with people in financial planning, I go to their house, I sit at their kitchen table, I gather the facts, I ask them a lot of questions, I get all the numbers, I come back to my office, I do a lot of work on it, and I go back and then I make possibly a recommendation on the second time, or maybe the third time, or maybe the fourth time.
Right.
Not a single person came to my kitchen table to tell me what was right for me. The people that were trying to tell me what was right for me. They didn't ask. They just told me because they know better.
Yeah, it's probably because what's right for them, because they were most likely working off a commission-based structure. And, if you're going to sell somebody a health insurance plan, pardon me, if you're going to sell someone a health insurance plan and you're making commission off the deal, the gold plan sounds a lot better than the bronze plan. And, it's a nightmare.
I'm actually referring to the people in Washington. I'm referring.
Okay.
Oh, yeah. I'm referring to the Grubers, to the Emmanuels, to the Max Boxes, to all the people in the taverners, all the wonks, all those people told me what was right for me.
Oh, they're definitely not interested in what's right for you. They are definitely. I have a tweet that I like to put out there, and that's how you and I met, was on Twitter. And I'll have a tweet that I put out where I say that all politicians can be bought off, every single one of them, all of them. And policy wonks and health economists can be bought off too. And in fact, I just did a podcast with a local health economist, Devin Herrick, and we discussed how I really believe that most health economists either work for the industry or just working to shore up the health insurance and healthcare industrial complex that exists. So tell us a little bit about this Gruber thing. That's a fascinating topic, and it got you autographed pictures from Mitch McConnell and Glenn Beck. And is Obama on that wall?
No.
Oh, okay.
No, I did ruin. I ruined a couple of his days though, so I'll take credit for that.
Just making sure that President Obama hadn't overlooked your work. So when you uncovered this Gruber thing, tell us. Tell us a little bit about that. Yeah.
Yeah. Let me backtrack, and I didn't really answer your question, but how I got involved in this whole mess in the first place was I believed that when the president said, if you like your plan, you can keep your plan, I believed him. Yeah, and the reason why I believed him is because he often spoke with qualifiers. Right. So a qualifier would, he would throw in, a qualifier kind of is a squishy way of not being 100% accurate about what you're saying. But he 100% said, if you like your plan, you can keep your plan. So without qualification, so I believed him. And then around the fall of 2013, we got the email from our insurance carrier saying, guess what? Your plan is not ACA compliant, and you're getting kicked off your plan. Yeah. It turns out that to replace that plan cost double. Now, just to give you a little context.
But wait a minute though. The president also said that your premiums would go down by about wasn't it $2,500 or something like that?
Yeah.
Did you believe that too?
Well, theoretically that made sense because that was apparently the cost of that was built into the insurance of covering people that were not covered. Okay. So that theoretically made sense. Yeah. But it didn't really happen. Right. But so where was I?
Your ACA plan was doubled. The price of your plan was doubled.
Right. So to give you a little perspective on that, so in 2013, late 2013, I have a son that's getting ready to finish his senior year of high school. So we're doing college. I had like a 20-year college plan set up as a certified financial planner. I had been building up this plan for 20 years for my son and my daughter. Now, if you're going to take away $6,000-$7,000 a year from somebody because they're doubling their cost, that blew up my 20-year college plan. Yeah. It was a real problem. Yeah. So, I'm from Philly, as you know, and in Philly I have an expression: if you're not angry about, I'm not happy unless I'm mad about something. That's not the exact terminology I use, but for today I'll say it. And I got kind of what's the term? I got kind of PO'd. So I decided I was going to figure out what was going on with the Affordable Care Act.
Okay.
And the way I addressed it was this way.
You made it your mission. Yeah. I love
Well,
it. Yeah.
well, I had some time. It was the end of the year, and people didn't want to talk to me in my practice around Christmas, the holidays.
Right.
So normally I'm doing compliance work, and I just decided that I was going to do something else. So the way I attacked it was this way: the media was cheerleading. They were just cheerleading back and forth, for or against. The administration was just lying, frankly. Right. And then we had a third group of people, and these people were called architects. So these people started showing up on TV or radio or everywhere, and they started explaining the whole thing. And so we had David Cutler, who I started out with, and he was really good on cost control, which I really want to talk about. And there was Zeke Emanuel, who I could not finish the information on Zeke Emanuel. That guy was a human headache.
And he's a physician, right? He's Rahm Emanuel's brother, but he was a physician who was working with the Obama administration.
He was actually in. He actually played a huge role by his own words on getting something passed called the excise tax, which is another thing I really want to talk about. He was in I forget what department he was in. White House. And then the third guy was this guy named Jonathan Gruber. So I worked through Cutler. I quit on Emanuel, and I start looking at Gruber. And I'm sitting right here at this desk, probably at this Mac, and to this side of me is my cat. I don't know if you can see it, but there's a cat bed here. I had to kick her out because she walks on my keyboard sometimes. And to the right of me was a dog. And that's how I explain it. I was sitting at my desk with a cat to my left, dog to the right, and I watched some video. And the video I watched, the first one I saw of Jonathan Gruber was just shocking to me, because the first thing he said that really shocked me was he loved Mitt Romney, and he loved how Mitt Romney approached ObamaCare in Massachusetts to solve a problem that they had created in Massachusetts. And the story he tells is, after meeting with Romney, he goes home to his wife and he says how much he loved Romney. And then he says, but I'm kind of afraid he could become president someday. And I thought, you're an economist and you're not supposed to be partisan in this whole thing, but you're afraid Romney's going to become president after everything you said about him and the way he approached it? There's something wrong with you.
Yeah.
And that's what got me hooked on Gruber. That one video, and it was a long video. I remember he's sitting there, he's being interviewed for Frontline, and there's yellow striped wallpaper behind him. I mean, I can see it right as clear as day. And he started.
So you didn't hack his personal computer. This is all video that you found online. You just done the research and found video of Gruber.
All as they say in Washington, it was all in plain sight.
Right.
It was all in plain sight. It was on YouTube. It was all you had to do is Google Jonathan Gruber's name. And on the Google machine, you click videos, and they're all right there.
Boom.
They're all right there. So you just had to sit there and watch them. And some of them were boring, and some of them were repeats.
Yeah.
But a lot of times, and one thing I did learn was he would tell the same stories over and over again,
right,
with little minor differences. And it was the minor differences that caught my attention, because I would think to myself, well, he didn't say that. What's he mean by that? He didn't say that last time. And what I learned, my second impression besides him, the Romney thing, was that the Affordable Care Act was a big tax grab. It was a massive tax grab. And I tried to share that information with basically anybody I saw on the news who I thought would be interested.
Wow.
And I was sending them contacts, and they wouldn't respond back. For example, Eric Bolling was probably the first person that could have broke this.
So let me stop you right there and just ask you this. So you're saying that the Gruber stupid videos that I showed in the beginning, those weren't the first ones that you stumbled across. You actually found something that was far more damning, far more damaging to the American people as a whole than calling them stupid, and that was a tax grab. He admitted that it was a tax grab. Yet you couldn't get any news traction off that?
Correct. What I got news traction, the Gruber videos I didn't find till November of 2014. I started looking at Gruber around November of 2013.
Wow. In
between, there was something really cool that happened, and that was I don't have an iPad anymore, but I used to sit there and watch TV with my family or whatever we were doing. And I had my iPad, and I'll tell you, for a while my iPad was smoking, and I'm sitting there on my iPad. I'm reading an article, or I'm going through some accumulator website, news accumulator, kind of like people know Drudge or whatever, or whatever it is, those types of things. And I saw an article, and it was highlighted. It was the headline was "Taxation Without Representation," and I thought, what? That's really cool. What is going on with that? So I click on it, and it's an article about a series of 4 lawsuits going through district court. One of them was called King versus Burwell. Yeah, and that might sound familiar. So I click on that, and I read, and it's about how they decided that exchanges, the healthcare exchanges, that the law is strictly written that says if your state doesn't have its own healthcare exchange, then, in other words, if you use healthcare.gov, then there's no you don't get subsidized.
There's no federal subsidy. Now, let's be clear. You're talking about health insurance now, not health care. Even though it's on healthcare.gov, this is all about health insurance.
Correct.
I like to make that distinction.
I'm talking about if you go to healthcare.gov and your income is of a certain level, you are getting a subsidy to help you with the cost of the health insurance.
Absolutely.
But the law says that if your state didn't build its own exchange,
Texas did not,
then there was no subsidy. And when I read that article, I realized I had a video of Jonathan Gruber saying that.
Wow.
I had a video of Jonathan Gruber saying, if your state doesn't build its own exchange, you're paying taxes, but your people won't get subsidized. And I had that video. I had notes on it. And what I did was I started trying to contact people about what I had, thinking I could support the lawsuit.
Let's unpack this a little bit and just say that again, you're being taxed. So I live in Texas, so I'm being taxed. I'm paying taxes, but people in Texas are not getting subsidized because our governor Rick Perry wouldn't do it. He wouldn't go for the Obama subsidies. He wouldn't go for I think it was Medicaid expansion or what have you. But anyway. Rick Perry said no, he was the governor at the time, and so Texas doesn't get these subsidies. Yet we're still being forced to pay taxes for the rest of the country. So that's the essence of taxation without representation, correct?
Right. That was Gruber's argument, and that was the argument in the lawsuits. Now, it was specifically about whether or not the state of Texas built Texas.gov, Texas health insurance healthcare.gov, or whether or not they said, no, we're not going to do that. We're going to use the federal website, healthcare.gov. Right. So that was the basis of the lawsuit. So I found that video and I started trying to get people that video, and nobody will take that video from me.
Wow.
So
did you try with anyone in Texas?
Well, I was trying for the people that were involved in the lawsuit. I didn't do a very good job. Yeah. So that is maybe March of 2014. Okay. I'm guessing my dates here. Around that time, my kids play sports, so I put the whole thing away for a while. And I stopped worrying about Jonathan Gruber and any of that stuff. And then on this accumulator website, the 2 cases, there were 2 of the 4 cases were ruled upon in district court in the same week. And I'd forgotten about the whole thing. And I click on a Washington Post article, and it's all about this King versus Burwell case. So I go into the comments section and I make a comment. Look at this video. This is Jonathan Gruber making the case against the government about these subsidies. And lo and behold, somebody involved in the lawsuit found my comment. Yeah. And the next day I woke up, and I'd forgotten about the whole thing. Well, I didn't forget about it. I go to bed, wake up, I look, and Michael Cannon, who writes for Forbes, it was also involved in the lawsuit. He got a hold of my comment, and he is now blasting this thing home. And it created a massive storm. So this is, I don't know, June, July of 2014. So I had all this video. I don't have the stupid videos yet. I had that. It takes off when I comment in the Washington Post. And, I get some people who want me to help understand what's going on with these lawsuits. And I help a little bit. Yeah. And then nobody ever calls me and says, hey, Rich, what else do you have? And I had a lot. So, I had all this tax grab and cost control stuff and stuff about what the craziness that was going on in Massachusetts, and nobody really paid attention. And then on November 2nd, 2014, I hope my wife doesn't see this. I think it was a Sunday, and I think it was my wedding anniversary. I was sitting here, which I should not have been, and I found those stupid videos, which was just bizarre. So
I bet that put a real kink in your anniversary.
I didn't really tell her about it.
Oh, wow. Good for you. Good self-control.
Yeah, smart. Keto happy marriage. Here's what's interesting. Stupid videos. I tried to get them to a journalist I had met in D.C.
Yeah.
The journalist was Robert Pear from the New York Times. And I emailed back and forth with Robert Pear of the New York Times, and he saw the stupid videos. We went back and forth, and he said, "Where is it?" I showed it to him. He goes, "Okay, thanks," and he never did anything about it.
Are you saying that the New York Times might have been slanted in favor of Obama and leftist policies? Is that what you're implying?
Well, I don't know, but
Right.
what's interesting is, this went on a lot of stuff went on for a long time, and I started to talk to journalists and meet journalists, and I actually, as an offhand comment, I wound up, I didn't know what was important.
Yeah.
So as an offhand comment, I'm going back and forth with a guy by the name of Beckett Adams from the Washington Examiner, who I almost met once. Okay. And I'm going back and forth with him on Twitter. I said, "Hey, did I ever show you this?" And he said, "What are you talking about?" I said, "I have my emails with Robert Pear. Would you like to see them?" And he did a whole write-up in the Washington Examiner about it, taking my email strand. So you can go ahead and Google Rich Weinstein, Robert Pear, Washington Examiner, and you can actually see my emails with Robert Pear that he ignored.
How long was it afterwards that you spoke to the Examiner after you had emailed this guy from the New York Times? Weeks, months?
Months.
Wow.
It may have been as much as 4 or 5 months after the whole thing went nuts.
So they had the scoop, and they failed to act on it. I'll jump in here and tell you that this has been my frustration as well, as I've reached out to lots of media types, because I'm going to say this without any hint of arrogance whatsoever. I know the cure for the healthcare problems that we have. Not health insurance, but the healthcare problems. And that is, I wrote a book about it, The Guide to Buying Health Insurance and Healthcare. And it's basically this. If you have a high deductible on your health insurance plan, then you should pretty much stop trying to use your health insurance to cover most of your health care. If you can get an MRI for hundreds of dollars that would cost you thousands of dollars underneath your health insurance coverage, it makes more sense for you to just go ahead and spend the hundreds of bucks on an MRI, something as complicated and supposedly expensive as an MRI. Well, I got to go on here and just say really quickly that the cure for the American health, what I call the great American healthcare fiasco, lies in people. It lies in individuals by the thousands, the tens of thousands, hundreds of thousands, and then by the millions. Once they start doing this and demanding upfront pricing, and we're starting to see this in the media now, finally, I think the whole healthcare system, this whole charade will break down. This house of cards will fall. But it's amazing. I've been at this for 6 years now myself, trying to get the media involved. And I have been amazed at the inertia, and I finally came to don't tell anybody, but this is a conspiracy theory I believe in. But I finally have come to the conclusion that I don't think the mainstream media, including the radical conservative mainstream media, is very interested in really fixing the great American healthcare fiasco. What say you, Rich?
I got a lot of experience rather quickly working with with Fox News, for example, because not a lot of people were even reaching out to me. So Fox, I turned down 10 national TV interviews.
Wow.
For the reason I did, because I didn't want to get shot, and I did get death threats.
Wait, did you ever threaten the Clintons?
I did not threaten the Clintons, but I will tell you that I probably shouldn't say this. My weapon of choice. My weapon of choice right here is a World War II sharpened trench shovel. That's right here. You can't see the handle, but it's 6 inches from my hand right now. But
it's a 6 hour. But go ahead.
Right. But it got weirder. It got weirder around here because I was getting calls from just all kinds of people, and I would ask, Byron York called me. And I said, how the heck did he find my phone number? He said, I'm in the media. I can find stuff like that.
Yeah,
and I thought, well, if you can find my phone number, then people who don't want me around can find me also.
Yeah.
So I was concerned. But I think your point is not wrong. I like the high deductible plan because insurance means risk management.
That's right.
It doesn't mean when I go to the doctor for the sniffles,
covering flu shots.
It's not intended for that, which is going to lead us perfectly into what we want to talk about, I think, and that is what was going on with the Affordable Care Act, what was built into it that people don't know, and then if we have time, or however long we go, the absurdity of what Bernie Sanders is recommending. It's absolutely absurd. It's absolutely absurd with respect to what the Affordable Care Act was based upon.
Yeah. Well, we're going to unpack this. This is the pardon me. This is the first episode of many, I hope, in which we discuss and reveal and revelate what went on, because I have my own opinions and assertions about what was behind Obamacare. First of all, I'm just going to throw this out there and say that I think the American health insurance, and probably part of the health care industry too, the bigger players at least, they wrote Obamacare. They didn't. They weren't standing by the sidelines as pure victims. They wrote Obamacare, and I think they had their very good reasons. One of which is, as we'll get into in a future episode, minimal essential coverage. The idea of covering flu shots and preventive doctor visits and things like mammograms, which you can buy for $99 in the Dallas-Fort Worth area. And I guarantee you that if more places were offering mammograms for cash prices, or if more patients in the Dallas-Fort Worth area started saying, hey, I'm just going to pay for my mammogram instead of trying to throw it on my insurance under Obamacare. How much is it again? I guarantee you that $99 price would go down, even more so than it already is. So cash works. Cash is still king. And thanks to high deductibles, it makes sense for Americans now to use cash instead of trying to use their health insurance plan. Well, Rich, we're going to wrap it up for today because but I promise you, we're going to get into all of these details and then some. And I want to thank you so much for coming on the show. This is very exciting, and I'm very, very happy to have you again. Your first podcast, and you haven't made that many appearances, and obviously you've gotten over your fear now, as you should have, because Trump's ruling the day. But why don't you tell our viewers how they can get a hold of you if they want to?
Okay, so I don't have a website. I'm available on Twitter, so you can hit me at PhillyRich1 on Twitter, and it's you won't see my face. You'll see a picture of I think it's George Washington with Groucho Marx glasses on, which is great because if I was wearing my black glasses right now, you would understand what I'm talking about. So you can hit me up on Twitter. If you do, and people have, then I'll give you my phone number and we can talk, or whatever you want. Yeah. So start with Twitter, and then we can go from there.
Yeah. And you work with clients across the U.S., correct?
Absolutely. I actually have clients in California I go out and see once or twice a year.
Great. Good for you. Good for you. Well, again, I want to thank you so much for coming on. I'm really looking forward to what we have in store. And folks, stay tuned to the series. Until next time, this is Dr. Kevin Wade Casey for Healthcareonomics. Stay healthy.
Now you can easily compare health insurance plans and pick the one that makes the most financial sense with the Dr. W's Equation app, available for Android and iPhone. And for more information on how you can save on health insurance and healthcare, check out my books, available now on Amazon, iTunes, and Nook. To help spread this message, please click the like button on this video. You can also subscribe to the Healthcareonomics YouTube channel and visit healthcareonomics.com.